Hello, I'm Dr. Neal Sher. I am an ophthalmologist. An ophthalmologist is a physician who specializes in diseases and surgery of the eye, and my special interest is in laser vision correction. I've performed thousands of laser vision correction procedures and helped improve or restore the vision of many, many patients. It is one of the most gratifying professional accomplishments of my life. PRK stands for photorefractive keratectomy. It is a procedure performed with a special laser called the excimer laser. The laser, by precisely reshaping the cornea, gets rid of nearsightedness, farsightedness, and astigmatism, and in most individuals gets rid of the need for glasses or contact lenses. To determine whether you're a candidate for laser vision correction, you need a full comprehensive medical eye exam that I perform here in the office. Many of you have heard of LASIK, which is a laser vision correction procedure that involves cutting the cornea, making a flap, opening the cornea like a book, lasering, and then closing that flap. PRK uses the same laser, same formula, and shapes the cornea in a very similar way, but there's no cutting. It's done on the surface of the cornea. After the surface cells are removed, the cornea is then reshaped with the same excimer laser, and the surface cells allowed to heal. The advantages of PRK are numerous, in my mind, over LASIK. For one thing, there's no cutting. Secondly, there's no weakening of the cornea, and the cornea is not susceptible to injuries which could occur any time after LASIK, even years later. There are some disadvantages to PRK. It takes longer to heal, a few weeks versus a few days. The actual procedure is painless. You will feel some touching and pressure around the eyelids. There's some cold saline used, and that can be a little uncomfortable. The actual procedure doesn't hurt at all. After the procedure, your eye will be somewhat irritated. It'll feel like a bad contact lens day. You may have some excessive tearing, which is very common, and lights may bother you. We usually tell our patients to go home, take a nap for a few hours after the procedure, and then start the eye drop regimen that we prescribe. The long-term results of PRK are excellent. I have now 25 years of follow-up from some of the earliest PRK patients that we did at the Phillips Eye Institute during the trials. They still see well. The results show that the correction is stable, does not generally need touch-ups, doesn't regress, and there is no long-term damage to the eye. It doesn't cause glaucoma, cataract, or macular degeneration, the diseases that we get as we get older. It's a very safe and effective procedure, and there have been millions of these done. Most patients see an improvement in their vision immediately. The higher the correction, the more striking the improvement is, even before they get off the operating table. During that first week, while the surface cells are healing, there's fluctuations in vision. Once that bandage contact lens that we use to help heal the surface of the cornea is removed, the vision rapidly improves, and most patients have driving vision within a week or two after the surgery. In the majority of patients, I do one eye at a time. This allows the patients to go back to work the next day after they see me for a brief postoperative visit. For patients who come a long way to see me, including many of the military patients who I donate my services to, I do both eyes at one time. It's just not logistically possible for them to come back and forth to get both eyes done. PRK is an extremely safe procedure. Of course, like any surgery, there can be complications. They are relatively rare and, for the most part, can be handled. In fact, PRK surgery is safer than long-term contact lens wear. The discussion of the risks, complications, and benefits of the surgery is important and can't be done on this brief video. When you're here in our office, we will discuss this in detail and written material will be provided. Thank you for watching this video. If you want more information, we'd love to have you come up for a consultation, call us or email, and look at the information on the website